My name is Daphne Schmidt, and I'm joined by my husband, Dr. Joel Schmidt.
Hey.
Joel and I have been members of the Haiti Twinning Ministry at St. Michael's since 2009. One Sunday morning many years ago, we were listening to the announcements after Mass, and Father Dan invited parishioners to a Haiti Twinning meeting to hear about the ministry and pilgrimages to Do Palais. At that first meeting, it was apparent to us that the ministry was intent on building a true partnership in Christ between the people of St. Michael and the people of Do Palais, Haiti. That commitment had great appeal for Joel and I, and has remained evident in every project and pilgrimage that our two communities have shared through the Haiti Twinning Ministry.
There's a folk saying that one should do something to care for your mind, body, and soul each day. Father Elisier Doris-Scott, the pastor of Do Palais in the early years of our ministry, recognized the importance of nurturing the minds, bodies, and souls of the people of Do Palais. Addressing the minds and souls of the people of Do Palais was a priority. As the village grew, so did its needs. The parish had long outgrown its small concrete church structure, and the many eager young minds of the children not only needed inspiration and nurturement, but the children had a great need for a hot meal that a new school could provide for them each day.
Once a beautiful new church structure was erected, serving Do Palais and the surrounding region, Father Elisier, the Saint Jean-Baptiste Parish Council, and the St. Michael Haiti Twinning Ministry worked together on a plan to expand and upgrade the school. Over the course of many years, the school began to grow. Local teachers were trained, facilities were expanded and improved, and grades were added to support student advancement. In a true partnership, funding, professional expertise, project management, construction, and administrative decisions were planned and executed through collaborations between the twinning parishes.
In 2011, Father Elisier approached the St. Michael Twinning Ministry for support in providing a health clinic for the village of Do Palais. The expansion of healthcare across the region was critical to improving the lives of the people. Not only were healthcare facilities few and far between, but transportation to those facilities was very difficult. The roads were in poor repair, and few people had any mode of transportation. While Daphne and I went to Do Palais on a pilgrimage in February 2012, we witnessed a scene that punctuated our mission for that trip. We watched a group of about a dozen villagers taking turns at the four corners of a flim-flam mattress that they were quickly carrying down the unimproved road. Following this makeshift parade was a woman carrying a bag on her head and another woman carrying a beach-sized umbrella providing shade to a woman in labor lying on the mattress. They were trying to get her to the main road where she could get a ride taking her the rest of the way to a clinic to have her baby. The next day, as we walked along the village road, we spotted a young mother returning to Do Palais, riding side saddle on the back of a motorcycle, carrying her newborn baby.
Our mission that trip was to gather information that would allow us to help start the Centre de Santé de Do Palais. The first steps in starting such a project were to make a formal assessment of the state of healthcare access to the people of Do Palais. Along with Father Elisier and the Parish Council, members of the St. Michael Haiti Twinning Ministry traveled to many healthcare settings in the area to observe and learn firsthand about healthcare and healthcare delivery in Haiti. Among those were Central Plateau clinics in Cange and Las Cahobas, run by Samni La Santé, a sister organization to Partners in Health out of Boston. We also visited a small clinic in Trianon run by Caritas. In Inch, we visited Midwives for Haiti, who travel the country providing prenatal care and education to young women in an effort to reduce maternal and infant mortality rates in the country. We also visited the new University Hospital of Mirebalais, a public-private hospital built and managed by Somni del Sante as part of a partnership with the Ministry of Public Health and Population, whose mission is to raise standards in the Haitian public sector and to take a pioneering role in the training of doctors, nurses, and other health professionals in Haiti. Through those travels, we gathered information regarding common healthcare issues, the structure of healthcare delivery, how medicines and equipment were obtained, challenges and opportunities, and funding options. The Haitian healthcare professionals were so generous with their time, we were trying to soak everything up like sponges.
In fact, here's a great story from when we were touring the new hospital in Mirbelet. As we walked down a hallway, Dan Burns glanced into an exam room and noticed a large package of furniture, basically plastic wrapped on a pallet. There was a label attached to the bundles, IMEC, the International Medical Equipment Collaborative. Dan got our attention and we quickly wrote the name down. Once we got home, Daphne contacted IMEC and found that they were a nonprofit committed to providing refurbished healthcare equipment at low cost to help improve healthcare capabilities in developing countries. A little further down the road, IMEC was able to provide all of the equipment for the Centre de Santé do Palais at a fraction of the cost.
After multiple meetings were held between Father Elisier, the St. Michael Haiti Twinning Leadership Team, and Caritas regarding the clinic design, funding structure, construction needs, and other related issues, it was decided to model the clinic after the Caritas prototype. By the spring of 2013, ground had been broken at the site of a parish-owned soccer field along the road between the church and the river. The primary focus for the clinic was to be pre- and postnatal care, triage, and patient education. Midwives for Haiti had been a tremendous support for several years, providing much-needed pre- and postnatal care during monthly visits to the village. The hope was that the new clinic could now provide this care. As an agricultural community with limited transportation options, the people of Do Palais required a triage-capable clinic to handle traumatic and acute conditions. If additional treatment was required, the pastor of Saint Jean-Baptiste would designate or provide transport himself to a hospital facility. After reviewing the information gathered by the St. Michael Twinning Ministry Health Clinic team, it was determined that dynamic patient education could help alleviate or even prevent many of the common chronic and acute conditions experienced by the Do Palais community.
As the walls of the clinic began to rise, they embraced 2 delivery/recovery rooms, 2 urgent care rooms, 2 exam rooms, a lab, a pharmacy, office space, a patient education room, and living space for staff. By April 2012, a preliminary equipment proposal was developed for IMEC based on the Caritas Clinic blueprint for the village of Do Palais. Maps and a suite materials/furniture plan were developed to be shared with Caritas. In June 2013, the final IMEC equipment order was submitted, and Father Jacques Bolisius, director of Caritas of the Diocese of Ench, was designated as the project's shepherd. Shipping anything in or out of Haiti is very difficult. There is no formal postage or package service operating in the country, so a shepherd assists in receiving goods and getting them to where they need to go.
It was an exciting day indeed when several months later, a large connex or cargo container made its way over rocky dirt roads into the village of Do Palais, carrying all the equipment to furnish the new Centre de Santé de Do Palais. As luck would have it, the St. Michael Twinning Ministry had a group of pilgrims visiting at the time of its arrival. Claire Folks laughs when she tells the story of Father Elisier rushing off to the school to enlist the help of some of the older boys to help unload the connex. Each suite of furniture was wrapped in plastic, destined for a specific room, so unpacking took great care and organization.
Caritas was very helpful in working with Father Elisier to staff the clinic. The clinic now has a competent staff composed of a physician, nurse, midwife, lab tech, pharmacy tech, and records keeper. One staff member in particular has very close ties to the St. Michael Twinning Ministry. Pauline Murthel was in nursing school in 2012 2010, when the terrible earthquake hit Haiti. She was badly injured after jumping out of the nursing school building that was crumbling around her. Through Loretta and Dave O'Donnell's many connections, she was able to travel to Richmond for medical care. She remained in Richmond for her 6-week recovery, living with Claire and Marshall Folks. After returning to Haiti, she was able to complete her education and move to Palais to work in the health clinic. We are proud to say today she serves as the chief nurse of the Centre de Santé de Palais.
Since the clinic opened for business in April of 2014, there have been some challenges, of course. Earning the trust of the community through the use of best practices and continuity of care was vitally important. In Haiti, many mothers give birth at home with the assistance of a doula, a woman who typically does not have any formal training, but who is employed to provide guidance and support to pregnant women during labor. The hope was that the new clinic could provide support when a pregnancy posed more risk to the mother and/or the infant. This relationship of working together to support new mothers would take time. So in the early days, we actually had very few deliveries. During its first year, 12 babies were born at the clinic. Since then, the clinic deliveries have grown to 1 to 3 each month. In addition, the clinic sees and treats many patients with common tropical ailments such as gastric upset, fungal infections, and bacterial and viral ailments.
Sustainable financing for the clinic has also been a challenge. The St. Michael Twinning Ministry, in collaboration with Caritas, underwrote the initial costs of the clinic and has continued to provide operational funds for staffing, etc. Although patrons pay a small fee for their healthcare services, the fees do not cover the costs of clinic operations, repairs, and staffing. Through quarterly reports, Father Novella Garcon, Father Nova, successor to Father Elisier, informs the St. Michael Twinning Ministry leadership about clinic usage, facility needs, and financial status. When the ministry was able to travel to Haiti, the health team visited the clinic regularly and identified any needs of the clinic for future action. Organizations such as Blessings International were invaluable in providing low-cost prenatal vitamins and medicines for the clinic. In 2020, the St. Michael Twinning leadership team entered into discussion with Father Nova and the St. John Baptiste Parish Council to determine steps to transition operational involvement from Caritas to the St. John Baptiste Parish Council. When the COVID-19 pandemic hit in April 2020, these discussions were sidetracked. However, current discussions are continuing to address this issue, as well as exploring means through grants and additional partners of supporting the growth of Centre de Santé de Palais into a financially stable healthcare provider.
Many blessings have been shared during the development of the Centre de Santé de Palais. Through a partnership of faith and support, a dream to improve access to health care for the people of Palais has become a reality. Continued efforts will advance clinic efficiencies and outreach as the clinic inspires hope in Palais and the St. Michael Twinning Ministry.